to pay for family coverage, they'd be paying everything they earned virtually for this. And the annual income of the average Walmart worker is about $17,000, kind of explaining why many Walmart workers are on Medicaid. But that's only part of the story. What's also happened is the increase of what I call underinsurance. And I have a definition of that. The number of people who are spending more than 10% of their income in any one year on health care. That's somebody who's underinsured, right? If they have health insurance, and so, or even if they don't. And what you see is that the uninsured, here, that yellow bar, is much smaller than the people who actually have insurance. The problem then is that the insurance is what I call Swiss cheese quality. Lots of holes. You know, people are having to pay more and more. And that's gone up from the year 2000, where we had about 41 million underinsured, to now over 60 million underinsured. And most of those are people with insurance. All right, so private health insurance, the for-profit market hasn't solved the problem of cost. Well, what about access? Okay, here you think if health insurance is linked to employment, if we went through a period where unemployment went down, more people have jobs, more people should have health insurance, right? Well, look at this. During the 1990s, we had the lowest unemployment in the United States since the 1960s. But every year through the 1990s, about 1 million more uninsured. A little dip in the end of the 1990s when the state child health insurance program was passed, S-CHIP it's called, and then an inexorable rise so that we're now at roughly 46 million people who are uninsured. When we get the data for this year, we think it's going to be closer to 48 to 50 million uninsured. But if you look beyond that, you know, just the way the Census Bureau gets these numbers is going out and asking you, do you have health insurance at this time or not? And you ask people, did you spend any part of the last 2 years without health insurance because you were switching jobs, because your job no longer offered health insurance, that kind of thing? You find that 81 million Americans had that experience, right? People are increasingly middle class who are uninsured. People are feeling more insecure. They worry that if they were in a car accident, if they developed a cancer, they would in fact have to, you know, liquidate their savings, mortgage their home. God forbid you do that today, right? And more than half the personal bankruptcies in the United States are due to medical expenditures. There are about 2 million personal bankruptcies. Over 1 million of those are due to health or medical expenditures. And 75% of people had health insurance at the outset of their bankrupting illness. Why did they go bankrupt? Okay, so they had lousy insurance.
Couldn't pay the premiums.
They couldn't pay their premiums. What? Pardon? They might be knocked off from their insurance. That's a possibility because of their major illness. The more likely thing is that they lost their job. And what happens when you lose your job? You lose your health insurance. And yes, maybe you can COBRA it, but then you can't afford the premium, just the way you said. So, and this, by the way, we just yesterday released a revised and updated study that is to the year 2007. This data actually comes from about 2002. And the new data is that we've gone up to 62 to 63% of personal bankruptcies in the United States are due, in fact, to medical expenditures. So the market has not increased access. Oh, what about choice? You know, we're told that's what markets are good for. You know, that's what for-profit health insurance should be helping us do. But when you find out in an interview, you find out that 42% of employees in the United States have no choice. Why is that? Their employer offers
one
plan, right? Exactly.
Sometimes they cover doctors that don't exist.
Cannot go.
Yeah, and the important thing is you go out and you interview people. Why did they change health insurance, right? And what you find is that 74% changed because the employer changed health insurance, not to get a less expensive policy. And the big problem with private health insurance in the United States is that it limits you to a network of doctors and frequently a network of hospitals, and you have to pay a lot more in order to go outside the
And
network.
sometimes the network of doctors that don't actually exist.
Right.
Or don't actually accept the patient.
So the choice that people really want is the choice of a doctor and a hospital, or the choice of a treatment or the location of a treatment, not so much the choice of a health plan. What people are really being offered is something like this. Thank you for laughing. It's so interesting. Some audiences don't laugh at this slide. But I think this, you know, they're being offered a meaningless choice. A choice of a health plan.
French audiences don't laugh at that.
French audience then. What about the issue of quality? Well, you know, frankly, we do have pockets of really excellent health care in the United States. But if you look at us as a total society, frankly, here we are, 37th out of 191 countries in the world in terms of the performance of our healthcare system. In 2008, we actually came out last among 19 industrialized nations, and we had gotten worse because we were 15th in 2006. So in those 2 years, we actually began to come out worse. And this is how the Commonwealth Foundation actually calculated that. And finally, the issue of the failure to encourage primary care, the decline of generalists, the rise really of specialists in our system, in spite of this kind of data. Here you can see the number of general practitioners, and by that I mean general internists, pediatricians, obstetrics and gynecology. If you have the higher number of those, let's say 5 per 10,000 population, what you find is that you have the best quality health care in the United States. These are states ranked this way. And interestingly, when you have more primary care doctors, you have lower cost. These things should be driving us to produce more primary care doctors, but that is not happening because the market, frankly, again, is distorting what people get. So this leads to my third conclusion. For-profit private health insurance has not solved the 5 major problems facing our system: escalating costs, declining choice, lack of access, uneven quality, and increasing specialization. In fact, we are an outlier nation. Look at this. In terms, our public system covers fewer people than all of these countries that you can't read. So I apologize. But, you know, these are mostly Western European, and then this one, everyone asks me, well, what's that country that only covers 50%? That turns out is Mexico. Mexico's public system covers more people than our public system, and we are an outlier in terms of private health insurance dominance, in terms of the expenditures. In all these other countries, even if there is some private health insurance, it usually amounts to no more than 10% of all of the expenditures in that economy.
If we're sick, should we try to sneak into Mexico?
I don't think that's the issue. The question is whether anything would be paid for if you went there, because your private health insurance and your Medicare probably won't work there. This leads to my fourth conclusion. Frankly, the time has come for a national health insurance program in the United States. And the real question is what the shape of that's going to be. And clearly, what I favor is a single payer